Dr. Prabakar, um, OBGYN, and I'm so excited to be with you guys today. I was on call last night, so I have my coffee with my branded practice cup, and I'm really excited to talk to you wherever you are in the world. Grab your chai and come hang out with me for the next few minutes, and we're going to be talking about a really exciting topic. I just moved into my house, so please excuse my pillows and things in the background. I'm yet to set up my office, but yes, we are going to be talking today about a good topic, and please ask questions and share with a friend. All right, so something that we have been trained as women is you make sure you use birth control because you are otherwise going to get pregnant. And so we spend all our lives, on some type of regimen or routine for birth control. And then finally, when you are actually trying to get pregnant, you get off of it. And for some people, you are not able to get pregnant. So today we're going to be talking about the 7 surprising reasons you're not getting pregnant and what to do. So, I'm a private practice gynecologist, and just this last week, I had a patient in her late 20s, and she said, okay, I've been on birth control all these years. I finally got married. I'm ready to get pregnant. I've been trying, and I'm not getting pregnant. And she was completely anxious about it and kind of freaked out like, oh no, what's wrong with me? Why am I not getting pregnant? And she had been trying for a few months, and she figured, okay, well, I went off my birth control and bam, I'm going to get pregnant. And that was not happening. And she was extremely distressed. So we're going to do a quick overview on the 7 reasons why this may be happening. And we'll do a whole session on one of these next week. So stay tuned. I have my notes, and the 7th reason is the most surprising. So please stay tuned to find out what that is. So 7 reasons you're not getting pregnant and what to do. So number 1, you're not ovulating. Now, to get pregnant, you actually need to have an egg that is released from the ovary that then goes and meets the sperm. So if you don't have an egg every month, you're actually not going to be able to get pregnant. You could be trying all you want, but no egg, no pregnancy. And some of the conditions that lead to this are PCOS as the first one that comes to mind, insulin resistance, and several other hormonal issues. But the first one is you're not ovulating. And number 2 is actually male factor. By the way, this is in no specific order, but number 2 is male factor. So a lot of women in my office are spending tons of time, money, effort, pain, doing all these tests. But the problem is not with them, it's actually with their partner. So in the 30s, a third of infertility is caused due to issues with a woman, a third is due to issues with a man, and a third is unknown. So, number 2, male factor, please do not ignore that and make sure your partner is getting tested. Okay, number 3, your tubes are blocked. This is something that you won't necessarily know until you start trying. Now, what can cause this? Gonorrhea, chlamydia that maybe you got when you were younger can actually scar your tubes and block them. If your tubes are blocked, you actually will not be able to get pregnant naturally. Now, endometriosis and other conditions, inflammatory conditions, can also block your tubes due to scar tissue. But if you're not getting pregnant, you may want to do a test that actually checks your fallopian tubes and sees if they're open or not. Okay. Number 4, you don't have a lot of eggs. So as we know, fertility declines with age, and 37 is the number at which it has a steeper drop off. So that could be a reason. I'll never forget this. Once I had a patient who was 52 who walked into my office, and she was like, "Hey, I'm ready to get pregnant," and I kind of was taken aback because I figured everybody knew that eggs started to decline with time, but not everybody knows. And so I want to remind you guys that eggs, the number of eggs, the quality of eggs, all of this goes down with age. So you just may not have a lot of eggs. And for some people, due to autoimmune conditions and things like that, they actually may not have eggs even when they're in their 30s. So this is something you actually want to check out. There's some blood tests for this. You can do an ultrasound to check it out. So keep that in mind. Okay, number 5, endometriosis. We talked about endometriosis extensively last Thursday, but endometriosis can actually have an effect on fertility. There's something about endometriosis and endometriotic implants that prevent or make fertility suboptimal and can actually reduce your fertility rates. And then there are also cases where due to endometriosis you have large ovarian cysts, which can decrease the quality of the eggs, or you can have scar tissue that block your fallopian tubes, for example, and prevent you from getting pregnant naturally. So endometriosis is definitely a cause. Number 6, environmental factors. So your exposure to plastics, phthalates, and all these harmful chemicals found in fragrant things, which all feel good, but they can actually reduce fertility. One really important one is paper receipts. Like when you go to the store and you check out and they give you a receipt, that receipt has BPA, which is harmful for fertility. I did a whole episode with Dr. Talia Siegel on environmental factors that affect fertility. So you can find that on my YouTube channel. It's about a 15-minute live. Make sure you check that out because I learn a lot from that session. So that can definitely reduce fertility rates for both men and women. And the last reason, number 7, which I think is the most important, is you're just not timing it correctly. Many many women think, well, the more I have sex, the easier it is going to be for me to get pregnant. And that's actually not true. There is a very specific time you need to try to conceive, very specific time in your cycle, and a very specific, routine. So just having sex multiple times a day, every day of the month is actually detrimental. So I'm going to do a deep dive on this next week when we're going to be talking about, how to time intercourse so you can actually get pregnant. And I'm going to be talking just about that next Thursday. So make sure you tune in for that. But I wanted to give you guys an overview about the top 7 reasons that I see in the office all day about when it comes to fertility and why women are not getting pregnant. So hopefully you have learned something with this, and this has given you some information to then take back to your physician. So a quick recap of the 7 reasons you're not getting pregnant. Number 1, you're not ovulating. Okay. Number 2, male factor. Number 3, your tubes are blocked. Number 4, you just don't have a lot of eggs. Number 5, endometriosis. Number 6, environmental factors. And number 7, you're not timing it right. So hopefully you can take an inventory of this and see what's going on, meet with your gynecologist and see where you could use some help or some work or just some advice so you can go on to get pregnant. And as I said, next week we'll be doing a whole deep dive on timing of intercourse and how we can optimize that in order to get pregnant. If you are in the Bay Area in California and you're looking for a gynecologist to walk you through this process, give you some advice, or maybe you've been trying for a while and you're like, oh, is something wrong? I've been trying for 6 months, a year, and you want someone to troubleshoot with you, come and see me. I'm in Lafayette, California. We'll put my info below, and I'd love to talk with you and help you start a family. All right, now I will take some questions. Okay. All right. Love the session. I've been trying for a year now. My partner and I did a lot of the tests. Everything's all right. But I recently discovered I've got fibroids. Yes, fibroids are a big source, along with endometriosis. Fibroids can also prevent you from conceiving, especially if they are in the cavity. I'm going to actually do a whole session on fibroids and how it's affecting your fertility coming up later this month. So stay tuned for that. But yes, you definitely need imaging, and perhaps you want to get them removed. I would definitely talk to a gynecologist about that. Any other questions? Will removing an endometrioma also remove eggs in the ovary? Excellent question. Anytime we remove an endometrioma, we are going to be affecting the ovarian tissue and the cyst wall. So yes, you can lose eggs from this procedure. Some patients will tell me just drain it, but don't aggressively remove the cyst until after getting pregnant. So there's a few different ways to think about it. Also depends if you're trying to conceive naturally versus IVF. Sometimes they really do need access to the ovaries to get the eggs. So if you have this big cyst sitting there, it's not going to work. So yeah, it's a little bit more nuanced, but yes, anytime you touch the ovaries, anytime you're doing a procedure there, you risk removing viable and good eggs. I was told it's not the same type that could impact on me not getting pregnant. I'm assuming you're talking about type of fibroid. Um, no, it's definitely the type, because if you have fibroids in the cavity, for example, that is going to prevent you from perhaps the embryo from implanting well. So the embryo can come in but doesn't have anywhere to stick. Now, also, if you have multiple fibroids, it can also be just creating an unfavorable environment to get pregnant. I've also seen that where it's not that the fibroids are big or all of them are in the cavity, but just the fact that you have fibroids can create an unfavorable environment. So I would definitely see a fibroid specialist. And if you're in the Bay Area, come and see me. We can help you. Can lifestyle factors such as diet and stress significantly impact fertility? Yes. This is, we all know people who eat really poorly, are overweight, they're eating fast food, they have a terrible, sleep schedule, but bam, they're pregnant. And then there are others who are exercising regularly, eating a plant-based diet, and still not getting pregnant. So is it an exact science? No. Is there a magic bullet? No. But we do know that eating an anti-inflammatory diet, so I definitely recommend more of a plant-based diet, and managing stress, exercising, sleeping well, all of these just boost the immune system and can aid in getting pregnant. So I would definitely pay attention to those. Okay. Hi, Makita. Great to see you. Um, I would. Okay. What role does male infertility play in couples struggling to conceive? So, good question. As I mentioned, a third of infertility or subfertility is actually male factor. So, as we know, it takes an egg and a sperm to come together to form an embryo. And if the sperm, if your partner doesn't have a lot of sperm, or maybe the sperm are not swimming well to meet the egg, or maybe the shape of the sperm is a little bit different. We call this morphology. So if any of these factors are off, it can definitely affect the sperm quality and fertility. Or if your partner has an infection, so these are easy to test. You can definitely see your doctor and give a semen analysis, and they can run this for you and help you decide if you need to do anything there. How can women with endometriosis improve their chances of conception? So with endometriosis is tricky. As we talked about in our last Chai with Cheruba series last Thursday. Sometimes you have just a couple of dots of endometriosis, but you can be in excruciating pain. Other times you can have endometriosis all over your pelvis and you don't have any symptoms. So it's a kind of a funny disease, but just having endometriosis, there's something about endometriotic implants around the pelvis that can actually affect egg quality and your chances of getting pregnant. We don't understand the exact mechanism, but we do know that this happens. So if you're somebody with, endometriosis and endometrioma, and you're trying to get pregnant, I would consider a laparoscopy, where we put a camera in and take a look, see what's going on. Is there endometriosis? Remove that and optimize your chances for fertility. So definitely speak to your gynecologist about that. Thank you, Makita. I hope you are learning something from this as well. Um, Thank you. Okay. Can I still get pregnant after having an ectopic pregnancy? How can I be sure to get pregnant? So, one can never be sure that they're going to get pregnant, right? We were kind of conditioned that that's how it is, but the truth is there's so many roadblocks, as I just mentioned in this video. Having an ectopic pregnancy, depending on your treatment for it, so sometimes the treatment is removing a fallopian tube. So if that happens, then, well, you only have one fallopian tube, but don't worry, you can still get pregnant. The egg, even if the egg comes from the other ovary, it's released into the body, and either fallopian tube can pick it up. It's a 50-50 chance. So you can still get pregnant. You do have a slightly higher risk of ectopic next time around as well. And so I would just monitor for that really carefully as soon as you get a positive pregnancy test to make sure that this is a good pregnancy and not an ectopic. Is there some magic pill to easily get pregnant? I wish. I wish. As a gynecologist, I see this, often, where there are people who don't want to get pregnant, who are getting pregnant, and then the people who've been trying for years who are not getting pregnant. It's the holy grail. Sometimes we don't know exactly why why someone is not getting pregnant at times, and so that's why I gave this 7-step algorithm to really look into it. But there is no magic pill. The best thing you can do is maintain a healthy lifestyle and watch the clock tick by, because the other thing is there's a false sense that you can get pregnant anytime, 40s, late 30s. And while technically this is true, you could get pregnant in your late 30s or 40s, but age is the number one factor in determining success. So whether you're trying to get pregnant naturally or whether you're using IVF or IUI, everything comes back to the age of the mother, age of the patient. So my best piece of advice is not to delay. So if you know you want to get pregnant, and especially if you have a partner, there's no perfect time. There's no perfect season of life or anything like that. Just go ahead and do it, because eggs do decline in number and quality with time. So we don't want to miss that opportunity. Okay. Any other questions? I love these questions. They're so good. Good question. So many people ask this: is the position relevant? No. Um, Sperm can live in the vagina for about 3 to 4 days. So however that sperm gets in, this position, this position, this position, whatever position, it doesn't matter. You just need that sperm to get in, and once it's in, it can live in the canal for about vaginal canal for about 3 to 4 days. Good question. Anything else? Does IUD removal affect? Hi, Deborah. Does IUD removal affect getting pregnant? Well, if you remove your IUD, then of course you are at an increased risk of getting pregnant. But you don't have to wait a certain time, if that's what you're asking. So there's no time limit or time that you need to wait after IUD removal to get pregnant. Fertility returns right away, so you can go ahead and try. Great to see you this morning. All right. I really hope that you guys learned a lot from this. Please share this video with anybody in your world who you think may be having a hard time getting pregnant or has been trying for a while or just has questions about it. Please share this with them. I know this is a great source of anxiety and worry for so many people, 20s, 30s, 40s. And we want to use these, make sure that we don't, we go through these 7 reasons and make sure we optimize that and that we're doing everything we can to make sure, that we're optimizing our chances for getting pregnant. All right, guys, this was so much fun. Thank you for your wonderful questions. And I will see you next Thursday, where we are going to do a deep dive on timing of intercourse and all that you have to think about with that to get pregnant. Okay, we'll see you. Have a great Thursday and a wonderful weekend ahead. Bye.